Good afternoon, everyone, and thank you all for being here. We're here to discuss the current state of COVID-19 in Chicago and to announce additional mitigation efforts that we believe are necessary to address the current state of the ongoing deadly pandemic. I'm joined this afternoon by CDPH Commissioner Dr. Allison Harwoody, CDPH Medical Director Geraldine Luna, CPS CEO Pedro Martinez, BACP Commissioner Ken Meyer. There's no denying that we are in a fifth wave of COVID-19. This new wave is seemingly more deadly than the last, spreading faster and causing profound harm. To be clear, I have not been this concerned about COVID-19 since the early days of the pandemic in 2020. The latest variant, Omicron, appears to spread more easily than its variant counterparts. Across the city, we have upticks in our metrics that we follow closely: positivity rate, cases, hospitalizations, and deaths. In fact, we are now averaging over 1,700 new COVID cases in Chicago residents every single day. And just to put that in perspective, not that long ago, within the last few weeks, we were at 300 plus cases a day and looking at a downward trend. That situation has been completely reversed and in all the wrong ways. Hospitalization in the city are at their highest since the surge last winter. Deaths are at a higher rate than we've seen in months. And on top of this, we can expect a post-holiday surge in cases. As I've said throughout the pandemic, we will leave no options off the table when it comes to protecting the safety and well-being of our residents. We didn't want to get to this point, but given the situation we find ourselves in, we simply have no choice. So, today, we are announcing that beginning on January 3rd, you must show proof that you are fully vaccinated to enter bars, restaurants, fitness centers, and entertainment and recreational venues where food or drink are served. Let me repeat that again. Beginning January 3rd, you must show proof of vaccination, whether it's your actual card, whether it's a photograph, whether it's something on your phone, but you must show proof to enter bars, restaurants, fitness centers, and entertainment and recreational venues where food or drink are served. We know historically and from the data, these are the places that are the most risky places for spread, which is why we're focused on them. This order will remain in effect until the city deems that the threat of COVID-19 to public health has diminished significantly, meaning when we are out of this current surge. Exempt from this order are houses of worship, K through 12 schools, grocery stores, office buildings, and residential buildings. Now, that doesn't mean that people who are in control of those spaces shouldn't themselves affirmatively take precautions. But for now, this order doesn't cover those venues. Also exempt are any individuals entering an establishment for less than 10 minutes for the purpose of merely ordering food or drink. So if you're going into that coffee shop to pick up and go, you don't need to show proof. But if you're going to linger, you're going to eat that muffin, you're going to sit down with your laptop, you got to show proof of vaccination. Other exemptions: any non-resident performing artist or athlete visiting our entertainment or sporting venues. So if you're on a team from another city, you don't have to show proof of vaccination to get into the venue. Any individual 18 years of age or younger participating in an organized school activity, or any individual who enters for the purpose of voting in a municipal, state, or federal election, although we don't expect that to be relevant, certainly in the short term. To reiterate, if you are a vaccinated resident, starting January 3rd, don't forget your CDC COVID-19 vaccination record card, or a physical or digital photo of that card to enter any bar, restaurant, theater, sporting arena, or other establishments that serve food or drink. For the vaccinated, you are free to go about your business, but show that proof. Now, another important exception in responding to our employers. There is a test out option for unvaccinated employees who work in one of these venues, not for the patrons, but for the employees. This is the only testing option. Employees only. To repeat, if you are a patron, you must be fully vaccinated to enter. And BACP Commissioner Ken Myers will go into detail about that. Now, someone will ask, how long will these conditions last? Or will there be more extreme mitigation measures imposed? The answer lies with the unvaccinated. Let's review. The virus spreads by insinuating itself into our bodies. It loves the unvaccinated. And the Omicron variant is spreading more rapidly than any other variant that we have seen to date. If you are unvaccinated, you are at the highest possible risk. In fact, over 70% of the people in ICU beds are unvaccinated. Amongst the people who are dying, over 75% are unvaccinated. So the evidence is clear. The unvaccinated are affecting the health, well-being, and livelihoods of all the rest of us. So to control the spread, we have to limit the risk. And a significant risk in our city remains the unvaccinated. To put it simply, if you have been living without having a vaccination, it's time for a change. If you wish to live life as normally as possible, with the ease to do the things that you love, you must be vaccinated in the city of Chicago starting January 3rd. This health order may pose an inconvenience to the unvaccinated, and in fact is inconvenient by design. We're entering into our third year of life under this pandemic, with deadlier and deadlier variants continuing to rise. Although we know that masking up, social distancing, and vaccinations work to stem the spread and the severity of COVID-19 infections, this is what we have to do to keep our health system from becoming overwhelmed by this new wave. As with any health order, the Department of Business Affairs and Consumer Protection will be fully and readily available to assist our businesses to adjust to this change, but also to make sure that there's compliance. Businesses seeking more guidance should visit chicago.gov/reopening. That's chicago.gov/reopening. They can also attend webinars that will be hosted by BACP to provide an overview of this new requirement, just as BACP did throughout the pandemic in 2020, to make sure that you are up to speed on what this means for you, what the implications are for your business, and so you can provide us with feedback and we can adjust and make any adjustments that are necessary to accommodate business concerns. And to be clear, the new order that we are announcing today has been done after collaboration and dialogue with all the various stakeholders that are being affected by this. Commissioner Myers is with us today to go into further details on resources and supports. I also want to remind everyone our ongoing vaccination efforts that can and must be utilized to meet this moment. Get yourself vaccinated. The vaccine is readily available. It is at pharmacies. It is at our stand-up sites. You can get it through your own personal physician. You can get it at the myriad of federally qualified healthcare clinics that are available throughout our city. But you've got to get yourself vaccinated. Residents can go visit chicago.gov/COVID-vax to find an FQAC or city-run vaccination site. That's chicago.gov/COVID-vax. You can also get a vaccine at home. We have available appointments still this week. You can find that on the same website, or you can always call 311. You can also get your vaccines and booster shot at your doctor's offices and local pharmacy. Once again, I'd like to thank our residents who have thus far received their COVID-19 vaccine and booster shots. Thank you for your diligence and care for the safety of yourselves and others. I know that this is frustrating and it's exhausting, but I'm going to tell you what, we all have to strap back on the armor. We've all got to do what is necessary to protect ourselves, our families, our livelihoods, our city. The last thing in the world that I want to do is stand before you at a podium like this and announce that we're shutting our city back down. That would be devastating. I don't want to have to take that steps. But again, it really depends on the unvaccinated. If you know someone in your family, in your friends' network, or just that you know that is unvaccinated, go to them, talk to them, listen. Send them to the CDPH website. Send them to the CDC to get information. Talk to them about what it would take to get them to stop being hesitant and get vaccinated. This new Omicron variant is deadly. It is scary. And we're seeing lots of cases in places that we hadn't seen before. We're seeing a lot of breakthroughs. Luckily, most of the people that are experiencing breakthroughs are suffering mostly mild symptoms. But folks, we've got to strap back on that armor, that mindset that we had at the height of the pandemic in 2020. That is what's going to be needed for the next couple of months to get through this latest surge. I'm imploring you, I'm begging you, do everything on your part to make sure that you are being safe, that the people in your household are being safe, and that you're doing everything that you can to reach those folks who still haven't gotten the memo that the safest, best way to protect yourself is with the vaccine. And with that, I'd like to ask Dr. Arwady to come to the podium for a few words. Dr. Arwady.
Yep. Thank you, Mayor. So I'm guessing everybody in Chicago knows somebody who has COVID right now, because we are in the middle of the biggest COVID surge that we have seen since before vaccines were available. I want to highlight some data to explain why this is a step that needed to be taken now and what we continue to monitor. So first, our travel advisory. It is not just here in Chicago, but across the country that COVID and the Omicron variant are surging. There are just 2 states, South Carolina and Louisiana, that right now are not on the travel advisory. I wouldn't be surprised if the whole country is orange by next week. I want to highlight that in Louisiana, New Orleans in particular was one of the first cities in a part of the country that often is not as quick to take these sort of essential requirements. They put these same requirements in place for people to be vaccinated or in some cases tested way back when they were in the middle of their worst surge over the summer. Here's what the numbers look like here in Chicago. As you heard the mayor say, we are averaging nearly 1,800 new diagnoses every day. On December 15th, we've had more than 2,800 cases diagnosed in a single day. That's almost the most we've ever had, and I expect within the next week to week and a half, we will see the highest number of COVID cases in this city that have ever been diagnosed. I expect we will see a little bit of a dip around Christmas, and then we will see a post-Christmas surge, just like we saw around Thanksgiving. And our concern is that we have a Delta surge now with this Omicron surge on top of it. Test positivity, again, the highest it's been in a year, 7.3%. And I want to emphasize that that is a big jump just since last week. 1 week ago, we were at 4.1%. 1 week ago, we had 80% fewer cases. A lot has happened just in the last week. Hospital capacity remains a major concern. Dr. Susan Bleasdale from the University of Illinois Hospital and Clinics, the Chief Quality Officer, and someone the health department partners with a lot, will be talking a little bit about the hospital capacity in just a moment. But I wanted to just highlight that across Chicago, non-ICU hospital beds with COVID-19 patients in them are at the highest census since January 2021, before vaccines were widely available. You see, they're not as high as they were at the peak of the first surge or the second surge, but we don't want to get there. Similarly, our ICU beds right now are at the highest census we've seen since January 2021, and we all know that hospitalizations lag behind these increases in cases. Where we look at our community transmission and risk matrix, we are at a very high transmission risk for cases per day. We have moved actually into the high transmission for test positivity and remain in substantial transmission for hospital and ICU capacity. So what changed in the last week? Where did we go from being in a not good place to a really not good place? The answer is Omicron. And I wanted to just highlight this graph for you. This is showing the breakdown of the variants that have been seen across Region 5, which is the Midwest, including Illinois. And if you go back, each of those bars is a week, going back here probably 3 months. Orange means Delta. Purple means Omicron, black means other. So you can see for months now, it's almost all been Delta. You've heard me saying more than 99% Delta week after week after week. Well, the week that ended December 4th here in Chicago, we tested about 300 specimens just in the new Chicago testing program, and 2 of them were Omicron, less than 1%. That's as recent as December 6th. 2 weeks later, the estimate, you see in purple there, just about everything is now Omicron. We're waiting on the specific details for Chicago here, but you probably heard that the estimate across the US is 73% Omicron, and that in the Midwest, it is probably even higher than that. I want to point out how quickly that changed. And that is why, just in the last week, you all suddenly know somebody who has COVID. And you may know someone who has breakthrough COVID or has been reinfected with COVID a second time, even a third time. Because Omicron is much more contagious than the Delta variant, probably on the order of 3 times as contagious. But what the other thing that we see is that vaccines, luckily, continue to protect against severe outcomes, especially when people get that booster. So what do we do to protect ourselves and our community from COVID and its variants? I don't have a different message for you, but I want you to hear that we have to double down on every one of these, and we need to do that now. First, we need you to vax up. And the new order that we're announcing today is to encourage that. We've looked at data around the country and around the world. It is measures like this that help limit the risk for people who are vaccinated in higher risk settings, as well as the employees in those settings. It also, we've seen, tends to encourage vaccination. We need people to mask up, for real. This is not in replacement of masking. This is in addition to masking. We need people to back up where you can. We need people to wash up, and we need people to test up. Testing is at an all-time high. We continue to grow capacity for that, but I want to encourage people to be adding testing if you're going to be gathering, particularly around the holidays. Even if people are fully vaccinated and boosted, the more you can be adding testing to that right now, just with how fast Omicron works, the safer those gatherings will be. I want you to really, if there's one chart to look at, please look at this chart. This shows hospitalizations, COVID hospitalizations in the city of Chicago over this calendar year. All of the blue are unvaccinated Chicagoans. The red that you are seeing more of as you move toward the right of this graph, that's getting more into the present, more Omicron, longer time since there's been vaccination. Yes, some more breakthroughs. But all of the blue on this graph is largely preventable. And in the first part of this graph, back in January and February, a lot of people had not had the opportunity to be vaccinated. But you all know there's plenty of opportunity now. And what we need to do is get the blue off of that map, off of this graph, if we want to protect our healthcare system. The last thing we want to do is what the Netherlands did. I don't know if people saw it, but on Sunday they announced that they were closing the same sorts of high-risk establishments that we're talking about ahead of Christmas and through mid-January, closing restaurants, closing bars, canceling holiday gatherings, even limiting the number of households that can come together. They're doing that and holding it through January because they are overwhelming their healthcare system. We don't want that to happen. And so many of the hospitalizations and the deaths here in Chicago are preventable with vaccine. Our vaccination rate continues to increase. 3 out of every 4 eligible Chicagoans have had at least a first dose, but there are hundreds of thousands of Chicagoans who have still not had a single dose of vaccine, nor have they had COVID in the past. So we've got hundreds of thousands of people as this highly contagious variant is here and growing with absolutely no protection. We also know people who have been more than 6 months since getting vaccinated, may be more likely to have a breakthrough, which is why we're recommending boosters. And people who have been trying to just rely on that old infection, we are seeing people get reinfected second and even third times. I don't have a perfect tool. This is the best tool that we have to help control COVID. By age, you see that we are still lagging in 5 to 11-year-olds. Just over a third of our 5 to 11-year-olds have had that first dose, which is why we made the decision that this order will apply all the way down to age 5. So again, anybody age 5 and up who wants to eat indoors in a restaurant, go into a fitness center, go into a place of entertainment where food or drink is being served, must be fully vaccinated. And by fully vaccinated, yes, I mean fully vaccinated as the CDC has defined it. 2 weeks right now, post your second dose of Pfizer or Moderna, or your 1 dose of J&J. We anticipate that the CDC may change the definition of fully vaccinated, perhaps to include a 3rd dose or a booster dose. If and when that happens, that will also apply to our order. So I want to be clear, get a booster now. If you want to be able to keep enjoying, without that chance of having to go a few weeks without being able to go to restaurants, even if you've gotten those vaccines, please get a booster also, although it is not a requirement right now within this order. We're following a lot of other cities that have done this, and we're doing it because our local data says now is the time that this needs to be done. Boston and Philadelphia, just in the last day or two, are announcing similar requirements, but we are saying fully vaccinated as of January 3rd. There's been a lot of opportunity already, and I don't want to give months for folks to be able to come into compliance. You will hear more from Commissioner Meyer about the details, but expect to see signs like this: vaccinations and masks required, up on restaurants and bars and some of the other settings that we've listed. There will need to be photo identification for people over 16, along with your proof of vaccination, and there will be much more to come, and there's lots of details on the website. But this will be in place, and as of January 3rd, you got to start having proof of vaccination. The last thing I want to just emphasize is that our vaccine administration remains relatively high, but not where I would like it to be. If you look in those most recent weeks, you can see that it's up from where we were, and that's good, but it is not up enough. Pink represents the vaccines that are being given in pharmacies. It is the #1 place where Chicagoans are getting first, second, and booster doses. We follow this closely, send extra vaccine, make sure there is availability. I need you to get a vaccine. If you're hearing there isn't vaccine available, that's just not true, and we will help you find it, no matter what it is. Unfortunately, our booster dose uptake has slowed right when Chicagoans will benefit most from receiving a booster. That red line shows you over the last few months what we've seen in terms of 3rd doses or boosters. And we have had 500,000 Chicagoans, more than 500,000 get a booster, but you can see that that has been tailing off after the dip around Thanksgiving. And right now is when we need folks to do this to help protect themselves. We are leading, we are ahead of the national average in terms of boosters, but it's not good enough. Only 32.5% of Chicagoans over 18 that are eligible for a booster have received them, compared to about 30% the national average. And only 55% of Chicagoans over 65 have gotten a booster, compared to about 53% at the national average. These are the folks who are, in some cases, having breakthrough hospitalizations. And we really need folks, please, get that booster. It's the best thing you can do against Omicron. Here's what our booster uptake looks like. By age, we have seen the most uptake among people in their 70s and 80s. We've seen fewer than a quarter, though, of people 18 to 29 get a booster. We need you to do it, too, just to help keep the spread down. Where we look by race, ethnicity, the lowest uptake for boosters is among Latinx Chicagoans. However, I want to point out that this is only among people who are eligible for a booster, meaning that they've already had that primary series. Black Chicagoans do remain the least likely in Chicago to have received any vaccine, and that's why our efforts remain very focused in any of the neighborhoods that are still less vaccinated. But this new order applies across the city. Who's eligible? Everybody over 16. If you've got questions about that, come to the website. When should I get a booster? If it's been 6 months since your Pfizer or Moderna vaccine, you should get it now. If it's been 2 months since your J&J vaccine, you should get it now. You can get vaxxed at home, as you heard the mayor say. And as a final reminder, anybody, if you're just hearing this now and you thought COVID was over and you're realizing it's not, or you're hearing people in your network getting COVID, getting serious about this means all the ways that we listed, but mostly it's about getting that vaccine. Please give us a call. 312-746-4835. 7 days a week, we have folks on there who will sort out whatever problem you have, including bringing first, second, or booster doses of vaccine to your home 7 days a week, if that's what it takes. With that, I will be pleased to bring up Dr. Bleasdale, again from the University of Illinois Hospital and Clinics, to talk a little bit from the hospital perspective of why this order is necessary at this time.
Thanks, Dr. Arwady, and thank you, Mayor, for having me here. My name is Susan Bleasdale. I'm the Chief Quality Officer at the University of Illinois Chicago Health System, or UI Health. I'm also an infectious disease doctor as well. At UI Health, we care for patients who live across Illinois, particularly, though, in communities near the west side of Chicago where we're located. You probably heard that these are some of the communities that have been hardest hit by COVID-19 throughout the pandemic. We are in the midst of likely the Omicron variant surge in Chicago, Illinois, and across the nation. At UI Health, we are seeing this similar significant increase in cases in our patients and in our communities, with a simultaneous increase in our hospitalizations as well. I want to give you an idea of what it looks like in our hospital today. We have 45 patients in the hospital right now with COVID-19 confirmed infections. Of those 45, 15 of them are in our intensive care unit. 5 of those are on one of our ventilators. We have 6 additional patients that are highly suspected or a person under investigation for likely COVID-19 infection. This is a significant increase from last week, where we had 30 patients in our hospital with COVID-19 infection. In the summer, we saw single digits at different points when we were in this low. This is a rapid increase for us that is more rapid than what we saw last winter, when we peaked at 70 to 80 patients in our hospital at that time. Our staff live in the communities that we serve, and due to the significant community transmission, as Dr. already mentioned, most people know someone who has COVID-19 right now. We've seen increases in infection in our staff and their family members, despite a requirement for vaccination at our health system. This is likely due to the Omicron variant. The cases do appear to be very mild, though, in those that are vaccinated, thankfully, and boosted as well. These increases, though, in patient cases and decreases in our staffing is significant for our hospital operations, on top of an already complex and acutely ill patient population that is not infected with COVID-19 right now that we care for. And we are not alone. Hospitals all over Chicago are experiencing the same thing, and hospitals all over the country. As of yesterday, there were only 18% of our ICU beds available across the city. Midday, we actually had no ICU beds available at our hospital. Hopefully we'll have a discharge and have a bed available later in the day for our next patient that needs to be in intensive care. Yesterday, COVID-19 only accounted for 20% of the patients in hospitals across the city. But with Omicron cases doubling every 2 to 3 days, our health systems are likely at risk of becoming rapidly overwhelmed. Our biggest concern is that we will not have the beds or the staff to care for our patients should the number of COVID-19 cases continue to increase at the current rate. I believe that the decisions announced today by Dr. Arwady and Mayor Lightfoot will help lower the transmission of COVID-19 in our city and keep Chicago safe as we face the latest challenges, Omicron, winter flu, and I believe this will help to further help prevent stress on our health systems. But as an infectious disease physician, a hospital leader, I am also asking for your help. Please consider vaccination and wear a mask when you are indoors, even when you are vaccinated. We have learned so much throughout this pandemic, and we have effective tools in our toolbox. Vaccination to prevent severe disease, masking, physical distancing, and testing. Choose wisely when and with whom you unmask, even if you're vaccinated and fully boosted. Utilize testing resources before gathering, especially around the holidays. Don't go to work or school or these entertainment venues, even if you're vaccinated, if you have mild symptoms of a cold. Even a mild cold can be COVID-19 or influenza, especially in our vaccinated population that may not have very significant disease. If you have not been vaccinated, please take a moment to reflect on that decision. Vaccination is not guaranteed to prevent you from getting infection, but it does protect you against severe illness and death, including, we think, against severe disease from the Omicron variant based on this early data and experience. If you are eligible to get a booster, as Dr. already mentioned, especially if you are at high risk for complications, please do so. We are here and we are partnered with you. We ask you partner with your health system to keep you safe. Talk to your providers so you can get care in a controlled fashion. You may consider seeing people in the office and maybe even telehealth. Talk to your doctors about your scheduled procedures and if it's advisable to reschedule them. Stay up to date with your preventive care. Use testing locations. Don't go to the emergency room where they're taking care of acutely ill patients. Go to one of the multiple testing sites across the city and state. We at UI Health are here for you, our patients, and our communities, and we serve Chicago and Illinois. We wish you all a safe holiday season and recognize the disappointment many of us are feeling facing this increase leading into the holidays. But we are here to partner with the City of Chicago, the Chicago Department of Health, and the people of Chicago. Together, we can help lower the transmission of COVID-19 in our city. Thank you. And I will turn it over to CEO Pedro Martinez.
Thank you, Doctor. And thank you, Mayor Lightfoot and Dr. Arwady, for doing everything you can to keep our city safe and our families safe. I hope our CPS families and school staff are enjoying their holiday break. I want to be clear, our plans are to have our schools open on January 3rd. Our plans are to welcome our children for in-person instruction, but I need your help. I need the help of our families. We've been trying to make sure that we ensure as much as we can that we can have a safe opening back after break. That is why we sent 150,000 tests that we scoured across the country to get. We sent them to our most vulnerable communities that have tend to be had the lowest vaccination rates, as well as having higher cases, especially during these times. And so please, I ask families to take advantage of that. We've asked families to take that test on the 28th. It was over 300 schools. And the reason for December 28th, working with our health team and our Department of Health, that is the day where we can capture, get the most accurate data for capturing cases right after the Christmas break or right after the Christmas holidays. Para nuestras familias, ojalá que ahorita están ahorita teniendo placer con sus familias en este break, pero necesito la ayuda de todas nuestras familias. Nuestros planes ahorita es tener las escuelas abiertas enero 3, después del break, pero necesito su ayuda. Por eso mandamos más de 150,000 exámenes para que nuestras familias puedan tomar ese examen el día 28 de diciembre, para que nosotros podamos regresar seguros. There will be we're asking our families to drop off those tests at FedEx locations. In most of the neighborhoods, the local Walgreens, you can drop them at your local Walgreens. We also, and you can go to our website and you can actually see a map of all the different locations. Across the city, there's more than 100 drop-off locations in these particular neighborhoods that we targeted. There's over 50 different locations. And in fact, in a few locations, we actually also partner with the libraries. For example, in Inglewood, South Shore, Auburn Grisham, the Southeast Side, Austin, and Alco Gardens. Those were areas that we wanted to add even more capacity for families to drop off their tests. So please, we ask families to take advantage of that. En toda la ciudad tenemos más de 100 lugares donde usted puede ir a nuestro sitio, a nuestro website, y puede poner su domicilio y puede encontrar dónde dejar los exámenes. Queremos que dejen los exámenes ese mismo día, el martes. Y por ejemplo, en muchas de las comunidades, el Walgreens que está ahí en su comunidad, ahí lo puede dejar el examen. Y para nosotros, dejando los exámenes el martes, podemos recibir los resultados para el viernes. By having the results dropped off on Tuesday, we can get the results by Friday, and we can also get that information so that we can be ready to ensure that any children who's testing positive doesn't come to school on Monday on the 3rd. Ladies and gentlemen, one of the things that we are preparing for is we know that there's going to be cases rising. And I want to share this with our families. We are going to take the most conservative approach as we see cases in our schools, particularly in areas and in schools where we know vaccination rates are low. So you are going to see us transitioning more classrooms to remote when we see those situations. As a parent, I know how difficult that is for families, but we have to take that conservative approach, especially as cases are rising. How do you avoid that? Get your child vaccinated. By getting your child vaccinated, we will have stability in our classrooms. But short of that, we're going to have to take more conservative approaches. With that and expecting that, we are going to continue our initiative with home tests, and these are PCR, where we're going to be getting, by the 3rd week in January, a weekly supply of 10,000 tests that we will supply to any child who's in quarantine so they can take that test. And when we get the negative results, we'll be able to bring them back earlier. Para nuestras familias, quiero que sepan esto, porque ahorita como casos están subiendo, cuando miramos que tenemos casos en escuelas, en comunidades, donde el porcentaje de familias que no están vacunadas y que están subiendo muchos casos, vamos a tener más niños que vamos a tener que sacarlos de los salones para que aprendan remote en la casa. No quiero hacer eso como un padre, yo sé que eso es muy difícil para nuestras familias, pero tengo que hacer eso para proteger nuestras escuelas. Pero para enero vamos a tener más exámenes de la casa que vamos a dar a todas las familias que puede usar ese examen para que si su niño tiene un resultado que es negativo, podemos regresar a su niño más pronto. So again, we're going to use these home tests as a strategy to get through the surge in the month of January as we're quarantining more children so they can return earlier. And again, parents, I know this is difficult. As a father of 2 children in CPS, I know how difficult it is when your children get quarantined, but we have to protect our staff. We have to protect our schools. So again, please continue to, we have seen a good stream of increased vaccination, specifically in 5 to 11-year-olds. In fact, we've narrowed the gap between the city and our district, with the city over 30% of 5 to 11 getting vaccinated. We're very close to that. So I want to thank our families for doing that, and please continue. Ahorita estamos mirando el porcentaje de niños que están vacunados de 5 a 11 está subiendo, y eso me da mucho gusto, y gracias a nuestros padres, pero tenemos que continuar y tenemos que tener más nuestros niños vacunados. And with that, I will bring up Commissioner Meyer. Thank you.
Thank you, Pedro. Thank you, Mayor. Good afternoon. My name is Ken Meyer, and I'm the Commissioner for the Chicago Department of Business Affairs and Consumer Protection. I want to thank the business community for their continuing to adapt during this pandemic. I have seen incredible collaboration as we work towards ending the pandemic. My department's core mission is to support businesses and protect consumers, especially during these difficult times. COVID-19 impacts our economy, no doubt. And we all know the COVID-19 vaccination is the key to a post-pandemic life. The vaccination requirements will slow down the spread of COVID-19 and its variants to help us continue our path to recovery. Following major cities like New York City and Los Angeles, Chicago required proof of full vaccination, as you've just heard, on Monday, January 3rd, 2022. This new requirement means that any individual 5 years of age or older will be required to show proof that they are fully vaccinated against COVID-19 to dine indoors, visit gyms, and enjoy entertainment venues where food and drinks are being served. Also, anyone over the age of 16 will need to show identification. The City of Chicago mask mandate remains in effect for public indoor settings. So let me repeat. The City of Chicago mandate for wear masks remains in effect for all indoor settings. As a reminder, outdoor settings include sidewalk cafes, outdoor patios, rooms with retractable roofs, and outdoor tents when their sides are open. The new public health order does not include capacity limits, and unvaccinated employees of these establishments and venues will have a testing option. The following are exemptions to the vaccine requirements: houses of worship, grocery stores. However, dining sections are not exempt inside a grocery store. K-12 schools and daycares, locations in residential or office buildings, the use of which is limited to residents, owners, or tenants of that building. Food service establishments providing only charitable food services, such as a soup kitchen, and O'Hare and Midway International Airports. Also, individuals can enter a location for less than 10 minutes for the purpose of ordering and carrying out food, making delivery, or using a bathroom. Establishments will be required to, 1, post signage at each publicly accessible entrance and at least one location inside informing patrons of the vaccination requirement. 2, keep a written protocol for their employees on the vaccination requirement and the procedures of that establishment. To learn more about the vaccine requirement, I encourage everyone to join one of our BACP webinars. We will be hosting starting tomorrow, Wednesday, December 22nd at 11 a.m., again next Wednesday, December 29th at 11 a.m., and on Tuesday, January 4th in the new year at 2 p.m. To register for a webinar, please visit chicago.gov/business education. The webinars will also be available on our YouTube, which is youtube.com/ChicagoBACP. Businesses seeking more information and guidance should always visit chicago.gov/COVID. Lastly, I know Chicago businesses have stepped up repeatedly to keep their customers and employees safe, and we must do so again to do what is necessary to protect Chicago and save lives. Thank you. And with that, I am going to introduce Dr. Luna.
Muy buenas tardes. Yo soy la doctora Geraldine Luna, directora médica del Departamento de Salud Pública de Chicago. Estamos hoy aquí para hablar sobre el reciente aumento de casos de COVID-19 y la propagación de la variante de Omicron. Lamento darles esta noticia, pero esta pandemia ha tomado un giro radical. 73% de los casos de Estados Unidos de COVID-19 son relacionados al Omicron. Estamos enfrentando una pandemia cruenta, como no la habíamos visto antes. Estamos teniendo aumentos históricos nuevamente en todas nuestras métricas de la ciudad. Y les hablo de la tasa de positividad, casos de infección, hospitalizaciones y muertes. De hecho, en promedio hay más de 1,778 nuevos casos en COVID-19 en residentes de Chicago todos los días en promedio. Las hospitalizaciones en la ciudad están en su nivel más alto desde el invierno pasado, cuando aún no teníamos vacunas. Las muertes son más altas de lo que hemos visto en meses. Además de todo esto, históricamente, siempre hemos presenciado un aumento en los casos de las reuniones después de las festividades. Por lo tanto, y por todo lo que les he anunciado, a partir del 3 de enero, debe mostrar prueba de que está completamente vacunado para ingresar bares, restaurantes, gimnasios, lugares de entretenimiento y recreación donde se sirven comidas o bebidas. Están exentos de esta orden los lugares de culto, los edificios de oficina y los edificios residenciales. También están exentos los individuos que ingresan a un establecimiento por lo menos 10 minutos con el propósito de pedir comida para llevar, pero deben usar cubrebocas o máscaras en todo tiempo. Reiteramos, si es residente vacunado, para el 3 de enero debe tener una tarjeta de registro de vacunación de COVID-19 del CDC o una foto física o digital de esa tarjeta en su cartera o en su teléfono. Para ingresar a cualquier bar, restaurante, teatro, estadio deportivo y otros establecimientos similares que sirvan comida o bebida. Existe una opción de hacerse prueba de COVID-19 para los empleados no vacunados de estos establecimientos. En pocas palabras, si ha vivido libre de la vacuna hasta este momento, se acabó. Es tiempo de retomar y reflexionar de los beneficios de la vacuna. La vacuna salva vidas y puede hacer la diferencia para usted y su familia. El COVID-19 es real y amenaza nuestras vidas. Si desea vivir la vida con la mayor normalidad posible, con la facilidad de hacer las cosas que ama, debe vacunarse. Esta orden de salud puede representar un inconveniente para los que no desean vacunarse, pero estamos entrando en el 3er año de vida bajo esta pandemia y siguen surgiendo variantes y cada vez son más mortíferas. Aunque sabemos que el usar máscara, el distanciamiento social y las vacunas funcionan para detener la propagación y la gravedad del COVID-19, estos mandatos son esenciales para no saturar, escúchenme bien, para no saturar nuestros sistemas de salud y hospitales. Que no se vean abrumados con esta nueva ola de contagios. Al igual que con cualquier orden de salud, el Departamento de Asuntos Comerciales está completamente y fácilmente disponible para ayudar a todos nuestros miembros, las empresas, con este cambio. Las empresas que busquen más orientación para visitar, pueden visitar a chicago.gov/reopening y allá pueden conseguir toda la información necesaria para poner en vigencia este nuevo mandato efectivo el 3 de enero. También pueden asistir a seminarios web organizados por la BACP, que es la agencia que brinda ese servicio al consumidor y a los negocios, para brindar una descripción general de este nuevo mandato. Los residentes también pueden visitar chicago.gov/COVID-Vax para encontrar un centro de salud calificado federal o un sitio de vacunación administrado por la ciudad para recibir sus vacunas. También puede recibir su vacuna de refuerzo en cualquier consultorio médico, farmacias locales o en nuestras clínicas llamando al, escúchenme bien, 312-746-4835 o visitando otra vez nuestra página web chicago.gov/COVID-Vax. También tenemos el programa de visita al hogar con citas abiertas, donde sin costo alguno y sin presentar tarjetas de identificación, puede recibir hasta 10 vacunas para los miembros de su familia con incentivos de hasta $100 por vacunación. Me gustaría agradecer a todos los residentes que han recibido la vacuna del COVID-19. Gracias por su diligencia y por cuidar la seguridad suya, de su familia y la de los demás. Realmente espero que con la ayuda de esta nueva orden de salud y el aumento en la vacunación dejemos atrás esta pandemia del COVID en el 2020 de una vez y por todas. Así que cuídese Chicago y felices fiestas a todos. Ahora I'll open the mic to Mayor Lightfoot and Dr. Awadi.
All right, we're happy to take your questions.
Thanks a lot, Mayor. All right, members of the media, Alejandra Flores, my colleague, will bring the mic to you, and I'm going to ask you if you could please keep your mask on while speaking. We're going to kick it off with Amy Jacobson.
Mayor, so New York City implemented proof of vaccination for dining in gyms back in August, actually August 3rd, and their numbers right now are the highest they've ever been. They're similar to ours. So why are we copying a failed system?
I don't know that it's a failed system. And when New York City implemented it, nobody knew anything about Omicron. We're doing what we think makes most sense for our city, given the data that we're seeing and the surge in cases. I mean, no one can feel comfortable, given the incredible vertical lift of the cases that we've seen, even in just 1 week. So we're following the strategy that we believe is best suited to protect our residents, and if we need to do more, we will do more, but we're taking this step by step. I don't see it as a failed strategy. I think that what we are seeing with Omicron, nobody else could have predicted, so we're using the tools that we know are going to work. But again, fundamentally, we must get people vaccinated. That is the thing. You saw the PowerPoint slide that Dr. already showed that showed the arc of hospitalizations and who was hospitalized. That sea of blue, those are unvaccinated people. Unvaccinated folks are putting themselves, but also everybody else at risk. There are a lot of things that I have to address as mayor, a lot of challenges that we face that are very complicated, in many instances, decades in the making, for which there are no simple answers or solutions. This isn't one of them. The solution is vaccine. The solution is vaccine. We have to get people vaccinated. The most severe outcomes we are seeing, hospitalizations, prolonged sicknesses, extended periods of problems even after they test negative, and deaths are in the unvaccinated.
Okay, the next question is probably for both of you on schools possibly going remote. So you've handed out 150,000, so that's roughly half of the student population at CPS, to healthy children from low-income, unvaxxed neighborhoods. What is going to be the threshold, and is it going to be school by school, or are you going to go all remote for every single CPS school?
Yeah, so it's interesting when you look at past actions, right? Go back to March of 2020. We have no evidence that shutting down schools, whole systems, has done anything to counter the spread of the virus. What we have evidence is that when we've done that, we've hurt children, that we've hurt their mental health, we've hurt their social and emotional well-being, and we've hurt their academics in ways that we're still trying to understand even today. So I don't see that as a viable option. Now, if the whole entire country shuts down, if the entire state and city shut down, I'm not going to put my families at risk. But short of that, I see we're going to be very granular, going school by school, classroom by classroom, and we will respond based on the information we're seeing. But this is why I'm very clear with parents. I'm going to be very conservative. I am going to err to the risk of transitioning more children to remote as we see the cases, which is why we're going to have home tests available so that we can then bring them back knowing that they're safe, knowing that they're negative. And so that strategy will be in place in January as we're planning for this, we think could be a sustained period of time, at least during the month of January, of higher cases.
Thank you, CEO Martinez. We'll go with Taman Bradley, WGN.
Yes, hi, Mayor.
I'm here.
How are you going to enforce this?
Well, I think we're going to enforce it the same way other cities have. You know, I've traveled to New York, to Boston, to LA, to San Francisco. You can't get into a lot of spaces without showing your Vax card, period. And so I think we're not going to have any difficulty enforcing it. Obviously, frankly, a lot of our restaurants and other venues are asking us to do this. We've had a lot of, I think, productive conversations with the various businesses that are going to be directly affected. Not all of them are going to be happy, but I think most of them understand the necessity of this and are on board with enforcing it. And as you well know, way before we came to this point, many venues were already doing this same thing. For example, United Center moved, I thought, very boldly and wisely months ago. We've seen a number of restaurants in other locations say you must be fully vaccinated before you can enter. I think this will give comfort not only to the patrons, the business owners, but also to the employees.
Will there be fines for businesses? I guess I'm just wondering about the process for enforcing. You talk about businesses have to keep a record in terms of what process they have in place for checking and all of that. So how does that go? I would imagine.
Yeah, it's not going to be any different in some ways than what we did during the height of COVID in 2020, particularly around capacity limits. We worked diligently with our business community. Inspectors from BACP went out. They'll be doing that again. And then we have, we believe in progressive discipline. We're going to be warning folks, but if we've got repeat offenders and we need to shut them down, we'll shut them down. I don't want to have to go there, and I think we should be way past that point where we see people that are not complying and trying to put their profits over the health and safety of their patrons and their employees. But if we see that, then we're going to bring the hammer down. There's no question.
Thanks, Mayor. Craig Wall, ABC 7.
Quick question, Mayor, in regards to some of these exemptions or not. What about those who are getting married? Is this going to apply to weddings and other private party kind of events?
If there's food, absolutely. What we are doing is trying to be very strategic, use the learning that we've had now almost 2 years into this pandemic. Where we see the highest risk activity are places where people have their mask off, where they're eating, where they're drinking. So yes, if there's food being served, we expect whatever the venue is to abide by these restrictions. And look, the truth is, I think you probably know in your own experience, increasingly people are saying you must be fully vaxxed to come to my party, to come to my event, to do this or that. That's the world that we're living in now. So this isn't like back in the early days of 2020 where all of this is new. People understand what they need to do to protect themselves and to protect others. We want people to live their lives as normally as possible, but these events that are optional, not mandatory, we got to get people to do the right thing, and that's why we're imposing these mitigation efforts.
Was there some consideration given to the unintended consequence that if people aren't going out, that you could have more restaurants or bars, perhaps not being able to make it through and going out of business?
Of course. We always look at, what is going to be the ripple effect of any action that we're taking, particularly around these kinds of mitigation restrictions. But look, my number one priority is saving lives. Saving lives. That has to be my number one priority, and it has since the time that I took my oath. And throughout this pandemic, we've been very clear. We're focused on saving lives. And we are concerned about this surge in cases. This is very concerning. As I said in my opening remarks, not that long ago, we were seeing cases in the mid-300s and on the downward slope of a mini surge that we had. We're at almost 1,800 cases now a day. That should be cause of concern for everyone. And as I said, we got to strap the armor back on. We got to do the things that we know will protect us. And this is one of those things. And hopefully we won't have to take other mitigation steps, but we're fully prepared to do that if it's necessary, because our number one priority is saving lives, keeping people safe.
Moving on to Mary Ann from NBC.
Sure.
Mayor, multiple sources are telling me that there was a COVID outbreak after your staff party last Thursday. So I have multiple questions, if we could go through them. Mm-hmm. Is that why some of your staff is now working from home as of today, as well as staff from other departments that work at City Hall have been told they may work from home for the rest of the week.
So let me.
I hope you're not going to limit me.
No. Let me be clear.
Thank you.
We had a gathering. Our office, the mayor's office, is really highly vaccinated. There's only 1 or 2 people that are not, and they've got approved exemptions. So we have a very high vaccination rate in the mayor's office. But as a precaution, we required every single person who came in to demonstrate that they had a negative COVID test. We offered COVID testing. So the similar kind of things that we're talking about here, that we've asked people to do, we did it ahead of the surge. Look, the reality is we're seeing a significant amount of community spread. You see that in the data that Dr. Artie has indicated. So we thought, out of an abundance of caution this week and next, we're telling our staff, if you can work remotely, work remotely. We're practicing what we're preaching, and we're doing things that we can do to protect our team. So yes, we said, and frankly, I think a lot of commissioners breathed a big sigh of relief. If people can work remotely, work remotely. So you're conflating a couple of things that has nothing to do with each other. The reality is we're seeing a significant amount of community spread in our city, and we're doing what we can to also keep our workforce healthy. This is a downtime where, frankly, a lot of people are off until the beginning of January, but for those that weren't, we said work remotely. It's not going to...
All of City Hall?
Pardon me?
How does that impact?
It's everybody across city government.
Okay, I still have questions.
So not just City Hall.
Please continue, though.
Yeah, go ahead.
At that party, were those participating in karaoke wearing masks?
When they were singing, they were separated, and then the other people that were in the audience were wearing masks. People wore their masks inside. As I said, we're highly vaccinated. We made people test before they could even get in, sign an affirmation that they had a negative test, and then people wore their mask inside.
Why are you not quarantining when one of the members of your closest staff has tested positive?
Because I follow what my public health commissioner says. I test regularly. I tested this morning. I'm negative.
Chris Todd,
And
CBS.
I'm fully vaccinated plus a booster. So I'm following the public health guidance.
Thanks for that, Mayor. Chris Ty, CBS.
Mayor, can you just outline, are there any financial penalties for individuals that aren't following these rules? I know in New York they've assigned $1,000 in some cases for when operators are in violation. Is there anything that restaurateurs or bar owners or business owners should know?
So I just want to make sure we're clear and we're talking about the same thing. You said individuals and then you said restaurateurs. We're focused on the businesses. We're not about trying to penalize people who try to patronize a restaurant, a bar, or what have you, and not being vaccinated. We're focusing on the businesses. I'll let Ken Meyer talk about, I don't have the specific fines and other penalties that are available, but it's the same thing that we saw and use as a tool when we were focused on capacity limitations. So there will be consequences. Again, our hope is we don't have to go to the punitive. I'm always about trying to educate people into compliance first. But yes, we want to make sure that people are complying, and if they're not, we'll take action against them.
I'd like to get an answer if there are dollar values assigned, if you could clarify that for us.
Sure. So when the business compliance investigators, that's the team that will actually go out to a business, the first thing they're going to do is they're going to make sure that the signage is up as required, both on the exterior door as well as inside. We'll also make sure that there is a plan for what the employees are supposed to be following, and that plan is being followed. Frequently when my investigators go into an establishment, particularly like a restaurant or a bar, and there is absolutely no mask wearing, then we know that business is not really taking this very seriously. We can write a citation for each of those things that we find that they're not in compliance with, and that can be a range of $2,000 up to $10,000. But normally, if we go in and a business is fairly compliant, there's nothing egregious, they're not really ignoring it, and because my investigators take this very seriously, and they'll find a one-off or two-off inside an establishment, we usually give them a notice to correct, and I've instructed my team for this cycle, for this where we are right now, because of this variant being so expeditious, I want a 24-hour notice to correct. So I want to follow up either the following day to make sure that they've corrected. But again, if something's egregious, that business owner is not following any of this, we're going to write them up.
And one other question for the mayor or Dr. Arwady, whichever you prefer. Do you have any recommendations or guidance for churches holding Christmas services in the next week or so? I know that places of worship are on the exempt list, but are there any messages to those church leaders?
Yeah, a lot of church leaders have reached out to us. Look, obviously this doesn't apply to them, but I think they should exercise caution. You've seen that a number of churches across the city have gone completely remotely for the foreseeable future, or certainly after the holiday season, out of an abundance of caution. We know that many houses of worship have parishioners that are over 65 or may have underlying healthcare conditions. And obviously, the faith leaders care about their community. So many of them are taking the precaution of going completely remote for their services. We certainly support that. We're going to continue to be in conversation with them, but we have not mandated one thing or another. But everyone should be taking caution. Everyone should be careful about what they're doing, how many people they're associating with, where they're going, how they're inviting people into their home or not. This is a time for us, as I said, we got to strap back on the armor and do what we know is going to make a difference to save people's lives and keep people healthy.
Mayor, why are you waiting till January 3rd?
The reason that we're waiting until January 3rd, after conversation with our business partners, is to give them enough time to adapt. We've got to get the signage up. They've got to establish a protocol for their employees. They've got to put their employees through training. That's a lot to do in a short period of time. That's why we're waiting.
Mike Flannery from Fox.
I'd like to ask Dr. Blaisdell and perhaps you, Mayor, about those charts. That kind of logarithmic growth, if it continues for just a couple more weeks, is going to put us...
I think that was actually Dr. Arwady's choice, but...
Okay, but I think you referred, Doctor, to how your hospital, you had no ICU beds this morning?
Correct.
Well, if that chart continues, so are we going to reopen McCormick Place? What are we doing? What's the plan?
One at a time.
So yes, by midday we tend to fill. I would say we filled for our ICU beds today. We're working right now to try to get transition of anyone that it doesn't need intensive care unit out to another bed within our hospital. But with this exponential rise, it is a significant strain. I have significant concerns about our health system, but all of the health systems, because as I mentioned, ICU beds are getting smaller, and if we continue to have more and more patients coming into the hospital, it is going to become critical.
Yeah, and
in 2 or 3 weeks, what are we going to do?
so let me just fill in a little bit. So since very, very early in COVID, we've been working closely with all of the hospitals across Chicago on a daily basis. They are telling us what their availability is, and we've been really clear, particularly with this surge, that we don't just mean how many beds do you have, we mean how many beds do you have that you're able to staff, because we are hearing that as staff are out, that decreases. And so we follow every single day. It is available. If you go to hospital capacity on the dashboard, you can see at the system level what availability is. We're very clear about that. How many patients are in with COVID? How many patients are in with suspected COVID? How many patients are in with non-COVID illnesses that are requiring hospitalization? So we follow this across the whole system. There's a lot of work behind the scenes to make sure that we can maintain capacity. One of the reasons I showed those charts of sort of where we are is that we are not at a crisis level right now, but we do not want to get there. And that's where requiring vaccination, it may not protect against all illness, but it is highly protective and helpful toward the hospitalizations.
Thank you, Mike. We're going to go with Colin from the Block Club.
Cesar, you can let him finish the question.
Do we have a plan for bringing in the National Guard and perhaps having medical personnel staff something like McCormick Place?
Let me just say this.
No.
Mike,
I can fill in.
calm down, okay? There's a concern, which is why we're standing here, but we're not at the cusp of our hospital system collapsing.
Yeah.
We look out many weeks ahead. We are in collaboration with our hospitals on a regular basis. Dr. already, through COVID and her team, have a weekly call with hospitals to make sure that we never get to that point. But we're concerned, obviously.
Yeah, and I would just add that We watch capacity limits. There are other things that you are able to do, which we have not had to do at this point. If we were thinking about things like having to cut back on elective procedures, if we were thinking about things like limiting certain kinds of activities, changing, standards of care levels, there is a lot of planning that has gone into that. We don't want to have to get there. We are not talking about sort of turning McCormick Place into a hospital again. We have learned a lot about how to flex and grow, but we've also learned that we need to act when it is necessary. And the decision today, and to the point of sort of why January 3rd, you have to be fully vaccinated by January 3rd, meaning if you didn't already start, you're actually too late, and you need to start on that now, so that you can participate in these activities. But we are, I worked in West Africa during Ebola, and I saw a health system get overwhelmed. I saw that health system shut down, and I saw the indirect effects that has when you can't take care of other things. We're not going to let that happen. This is a step where we're trying to thread the needle on getting people to do the most important thing, yes, to protect themselves, but also to protect our health system, and that's to get vaccinated.
Thanks, Dr. Colin from the Black Club.
Hey there. So what would the next steps be in terms of safety mitigations if the surge worsens? And are there any sort of milestones or metrics that would need to be hit to make those next steps? God forbid.
We're not going to speculate about a place that we're not at yet. That's not productive. We're not going to do that. We're telling you right now what we see. We're telling you about the steps that we believe are important for us to take so we don't have to get to those next steps. But we know what they all are, but I don't think it's necessary or productive to speculate about something that, frankly, we hope never happens. We hope that the alarm that we are sounding today gets through to people. And I urge you in the media, sound that alarm for us. Talk to your listeners about what needs to happen and what people need to do to protect themselves right here, right now, today. That's why I place a heavy emphasis on in my prepared remarks around the unvaccinated. They're holding our fate in their hands, and really whether or not they get that jab in the arm. Talk to everybody you know who's unvaccinated. Our future is going to depend upon whether or not they stop being hesitant and get the vaccine. I don't want to shut the economy down. I don't want to have to take other mitigation steps. We have been through hell and back in the last 20 months. Nobody wants to go back to that time, least of all me. But if we have to take drastic steps, we will take them. I hope we never, ever have to get back there again. But it really depends upon the actions that people take here and now. We are in another crisis, and we've got to act accordingly. Get vaccinated.
Thanks a lot, Mayor. That's a wrap, everyone. Thank you. Thank you, Marianne. Thank you, Mayor.
Exposure was last Thursday.
You're saying something that you don't know is true. You don't know that that's true.
I don't understand.
No, what I'm saying is you have no idea when my exposure was. The practical matter is I test on a regular basis because I'm out in community regularly. I test regularly. I test multiple times a week because I'm out in community. So I have been testing regularly. I will continue to test regularly. I care about my own personal health. I care about the health and well-being of my family. I care about the health and well-being of my staff. So I'm testing regularly, and you're conflating and trying to pull something together that doesn't make any sense, Marianne. We have a ton of community spread. Our people live in the community. Right? And so we're doing everything that we can to protect them. And we're taking precautions. But you're trying to say, Link, someone was at a party, so no, I don't believe that to be true. There's a lot of things that have happened between last Thursday and today, 5 days later. Look at the spread that we've seen in our community just in 1 week. So I'm being cautious because I have to be, for myself, for my wife and my child, and because I'm the leader of the city. I'm practicing what I'm preaching. So I will continue to be cautious, and I will continue to make sure that if I feel sick or if I feel like I've got symptoms or I'm exposed to somebody, the first thing I do is I call Allison, and I explain the circumstances to her, and I follow her advice. So that's the advice that I care about. Thank you.
Thank you, Mayor.